Hello, welcome everyone. Thank you for joining us for today's briefing about the HSTA's recent settlement agreement regarding the health benefit portion for the next 2 years of our contract. My name is Osa Tui, and I'm the president of the Hawaii State Teachers Association. Before I begin today, I want to recognize and acknowledge the work of the volunteer members of our negotiations team. Those members are Chair Diane Mokuau of the Moloka'i chapter, Vice Chair Jenny Olean from the Hilo chapter, Kathy Shibuya from the Kauai chapter, David Nygaard from the Maui chapter, Shani Kaku, your Secretary-Treasurer from Hilo, and Logan Okita, your Vice President from Central. I'd also like to acknowledge the work of our Executive Director, Ann Mahi, our Deputy Executive Director and Chief Negotiator, who's with me today, Andrea Eshelman, and our Negotiations and Research Specialist, Colleen Bird. All right, Andrea, if you can take it away.
Good afternoon, everyone. I'm going to go ahead and share my screen here as we get into our slide deck. Right, so we're going to cover a number of things on our agenda today. We're going to cover the process of the reopener negotiations itself, the internal process that HSTA goes through as we reach agreement and the eventual board approval. We're also going to talk about the changes to the employer contributions for 25 to 27. We're going to talk about some benefit changes that are happening specific to options that you have within EUTF. And then we will also talk about some considerations you should look at as you are selecting plans, making changes, adding beneficiaries, things of that nature, as open enrollment is coming up soon on May 1st. What we're going to do today is that we're going to have this live broadcast on Facebook. We were having some difficulty with YouTube, and so we'll post that later. So you'll be able to watch the broadcast at a later date. But in addition, if you are joining us on Facebook, you can put questions into the chat. We'll be monitoring it. Our Vice President Okita will also be trying to answer questions live, and then we'll address any questions at the end. I will note we're not going to address anything that's personal in nature. However, we'll try to address any sort of broad-based questions and answer those as needed. We also encourage you to go to HSTA.org, where you can find an article related to the settlement. You can read the actual contract language that we reached related to EUTF, and you can also find a reference sheet, which we'll show you some screenshots of later, reflecting all the changes in each of the health plans. So in early April, we actually completed our reopener negotiations, and we want to share a little bit about how we got there. We currently have a 4-year contract. This contract started in 2023, and in that contract, which goes through 2027, we did have a reopener only for EUTF contributions. So the negotiated agreement had dollar amounts set for the first 2 years of the contract for contributions. And then there was this reopener to allow us to negotiate additional dollar amounts or increases in dollar amounts. Without any sort of agreement, the contract language as it currently stood indicated that the contributions that the employer paid towards your health premiums each month would stay the same as they are right now in 2025, meaning any additional increases that happen with the plan that you select would have to be absorbed by the employee. And so we had this opportunity to go back to the table and engage in some bargaining to get an increase. I will note that there isn't a right to strike with this reopener language. And so we really had to try and reach an agreement in time to meet some deadlines with legislative funding and open enrollment and things. And if we didn't, then we would be left with the same contributions. We also want to note that one of the things that affects EUTF negotiations in particular is that the state has taken the stance for many, many years that they want to keep the amounts of the premiums that they pay towards employees for different plans and for different plan types the same. So regardless if you're working at UH or the Department of Transportation or the DOE, regardless if you have a self-plan 80/20, they want it all to be the same. And so one of the dynamics that we run into is once one union who's in active negotiations agrees or reaches agreement, that sets the stage for everybody else. That's the model that everybody else is sort of left with. And so in our case, during the bargaining towards the end of March, we learned that UPA had settled their EUTF numbers. And so because they had agreed to what the employer had proposed in late March and had a ratification, our team had some decisions to make. So as Osa indicated, we have a team of 7 folks. 4 of which come from our negotiations committee and then our 3 state officers. They had a series of discussions to prepare for bargaining, and they did propose putting overall increases to the employer contributions on the table. We also proposed moving the cap from 90% to 99%, and we'll talk a little bit more about what that is. The cap concept can confuse people a little bit. But the employer on April 1st came back to us after they learned that UPA had ratified, and they rejected our proposal. And they reiterated that they would be willing to agree to what they got UPA to agree to. And so we agreed to the employer's offer at that point in time. The team then notified our HSTA negotiations committee as per our process internally. The negotiations committee then met, and we had been keeping them apprised of our progress throughout time. And they met, they reviewed the proposal, we discussed it, and they had to make a recommendation to the HSTA board of directors. Their recommendation to the board of directors was for approval, and that was a unanimous recommendation. And then it went to the HSTA board for approval, and they also approved it. And so with that, we had settled the reopener on the health benefits or the EUTF contributions. I will note, some people have asked, does this require ratification? It doesn't, because it's just a midterm reopener. It's treated as a supplemental to the current contract, because your current contract goes all the way through June 30th of 2027. So that was our internal process. What did we actually agree to, or what did we reach settlement on? Going forward, starting July 1 of 2025, we will see increases in the contributions from the employer, but it will be continue to be modeled on the same thing that we have in the current contract, which is a 60-40 split on the HMSA 80-20 plan. The cap will remain at 90%. And what that means for our members is an additional $7.5 million over the bargaining unit being paid by the employer towards those 25-26 premiums. If we had not reached that agreement, that $7.5 million would have been absorbed by all the folks who have health care plans, because again, the 2025 premiums would have been kept status quo related to the contributions from the employer, and then employees would have to absorb any of those costs. This did avoid those status quo rates, and it locked in that increased funding in time for the legislative deadline, which is at the end of this month, for it to be in the budget bills. And also importantly for us to make the deadlines that EUTF needed in relation to preparing for the May 1 open enrollment. So starting on May 1st, folks are going to have the opportunity to change plans, to add, to drop, to add a beneficiary. Maybe you need to add a child or take a child off or what have you. All of those things start on May 1st. On our website, and also at this bit.ly, which is bit.ly/2025 HSTA, all in caps, UTF. And again, you can also find it linked on our website, is a full reference sheet. So what we did was we put together a reference sheet that lists all of the plans. This is just a small snapshot that you have here. The plan's current dollar amounts, so the overall monthly rate for that plan, as well as what the employer is currently covering for the premium, as well as what the employee has to cover. And so we're going to go into a little bit of a deeper dive and show some examples going forward, but just to help folks understand this reference sheet, and again, you can go and look at it in depth on our website. For example, the 80-20 plan is covered by the employer at 60%. And in this example, or in this case, we're talking about the self plan. The overall monthly cost currently is $841.62. 60% of that is $504.96. And then the 40% that the employee would cover for that single plan is $336.66. So in 2025, again, starting July 1, the cost of that health plan premium on a monthly basis will go up, going up by just a little shy of $50. And so it's now going to be $890.62. Again, the employer and the negotiated agreement will keep that at a 60% coverage. And so each side, the employer will pay more, the employee will pay a little bit more. And so it's $29.40 for the employer, $19.60 for the employee. So it's a 5% increase overall for the employee. The charts that we have list all of the plans, all of the changes. Some have gone up, some have gone down. And so you'll want to look at across that to see sort of the overall costs and as you weigh your decision about your health enrollment. Related to 75-25, this is where the 90% cap comes in. And so the employer doesn't want to they want to receive the benefit of some of these lower cost plans. And so they aren't willing to pay 100%. That's one of the things we've been trying to work towards, is a plan that's essentially free for folks. And so they have this 90% cap. They want people to pay at least something related to the cost of their health insurance each month. And so you'll notice the difference in just the current plan rates, right? So $841 for a single for the 80-20, right now $524 a month for the 75-25 plan. And so when you take the 60% premium of the 80-20 and you apply it here, you actually get to the 90% cap quicker than using up this full 504. And we'll show some charts here in a moment. But suffice to say, this plan hits the 90% cap. And so you can again see the increase for next year goes up to $586 a month. And then over here, you can see the employer change. So the employer paying $55.84 more per month, and then the employee change of $6.22 a month. So we're going to look at some additional charts that might help folks visually see in a different way how this applies. And so here is the plan that we base the contributions off, the dollar contributions. And so the HMSA 80-20 plan, this is the total cost each month. And then the employees pay 40% of that, and the employer is paying 60% of that. And so 60% of the 80-20 plan for single, in this case, $534, you saw that number on the earlier chart. So when you apply it across different plans, that $534 amount, or you see across here on this little dotted line, it ends up buying more or less amounts of a plan. And then that means that the employee has to absorb some of that added cost. And so you see when you apply the $534 to a 90-10 plan, for example, the employee is going to have more to cover on their end, because that is a much more expensive plan, similar for HMO and then the Kaiser Comprehensive. Then you look at you move into that conversation about the cap. And so some people get confused about that. They're like, well, why doesn't the 534 get used up 100%? If I apply 534 to the cost of the 75-25, which is $586, I shouldn't have to pay that much. It should be a lot closer. Well, again, this would normally buy 91.1% of the plan. However, the employer is only going to pay 90%. And so you don't get that last 1.1% towards your 586, or in the case of the Kaiser Standard, it actually buys 95.2% of the plan. And so what ends up happening is you have this 90%. So the 90% cap caps your 534 contribution towards that plan of 527 and 505 in the case of these two plans. And that up here, you'll see it says employee share is 10%. So essentially the employer has held the line and said, we want employees to have some responsibility towards that monthly health premium. And we've determined that it's a minimum of 10% we want. Osa is going to talk a little bit later about how those monthly premiums versus how much you're paying out of pocket, how you need to factor in all of those things as you're making a decision. Do I want to move to a 75-20 plan, 25 plan, because it's a lot less per month? Do I want to stay with that? Do I want to move to a Kaiser plan? There's a lot of factors that come into play when you're considering what type of plan you want to utilize. Okay, so I'm going to turn it over to Osa, and he's going to get into the difference between what's a PPO and an HMO and how do they affect your health coverage, maximum out-of-pocket costs, and things of that nature. I will note that Osa is a trustee on the EUTF Trust, and so he gets to get into great depth as a trustee and learn all about these plans. And so if you have some questions for him about that, you feel free to put that into the chat as well, and we'll try to answer those questions. Osa?
Thank you very much, Andrea. So yes, I am one of 5 employee trustees on the EUTF board. There are also 5 employer trustees on the EUTF board. And so all of us working together on the employee side try to maximize the benefits that we can get for our health plans. And I've learned a lot being a trustee, and I've really felt that there's a lot that needs to be provided to you as our members in terms of education, because there's all these numbers flying around and all these different things. Where, you know, the benchmarking of 60-40 on the 80-20 plan for HMSA, like, what the heck does that mean? So I'm hoping to dispel some of those, like, I'm trying to make things clearer as to what the heck all of that means. So first of all, I wanted to talk about some of the benefit changes that we're going to see for this coming benefit year, starting on July 1st. First of all, the HMSA HMO plan is going to be closed to new enrollees. So if you are currently utilizing an HMSA HMO plan, and there are not very many people who are utilizing that plan, it is the lowest utilized health plan of all the health plans that are offered by the EUTF. And so as a EUTF, we were looking to streamline them. However, we know that some people are very dedicated to the plans that they have, and so we didn't want to kick anyone off. And so those of you who are currently on an HMSA HMO plan may continue on that plan until it disappears. In the future, you'll still be able to add or remove your dependents. However, the costs are likely going to rise over time as the pool of subscribers and dependents dwindles. There are no changes to the Kaiser HMO plan, so you can go into those or out of those as you please. But it's the HMSA HMO plans. And I'm going to talk a little later about what the heck that means, HMO and so forth and so on. But before that, there's another big benefit change that is happening that we talked about in October. It was one of our teachers who got the ball rolling on this. And it was about your adult dependent, your children who are adults and are less than age 26. Well, it turns out less than age 26 or less than age 24 or less than age 19, there are all these different rules. And so until the end of June, or in the current benefit of the current plans, if you are an active EUTF member, meaning you're working, an EUTF member is working and not retired, and you had a dependent child, that dependent child will lose their medical and prescription drug coverage at the age of 26 for active EUTF members. Now, if you're a retiree EUTF member, they would lose it at 19 or at age 24 if they were a full-time student. And then dental and vision for all active and retirees, you would lose it at age 19 or age 24 if you're a full-time student. And so you have these ages, 19, 24, 26. It's all kapakahi, and what the heck? And why do some get some benefits and some don't? And what's up with that? And so again, we were looking to streamline things. And so starting July 1st, we no longer have all those issues. If you have a dependent child up until age 26, so 25 and younger, they are eligible for medical, prescription drug, dental, and vision coverage under your plan that they can have until they turn age 26. There is no requirement anymore for them to be a full-time student. They can just be doing whatever they want. And so long as they're one of your dependents until that age, you can put them on your plan. They can be married. They don't even need to live with you. But if you previously had them off or you never wanted to put them on and now you might want to put them on, you must re-enroll them if they were previously dropped or they weren't on to begin with. And so this open enrollment period is when you can put them back onto your plans until they turn 26. All right, next slide, please. There's a whole bunch of new benefits that are available, and I'm not going to go through the whole list, but they are available at these 2 websites. If you're watching the playback, go ahead and pause the video now and capture those websites. You can go on the eutf.hawaii.gov website for all the information that you want. I will also mention that we are hosting, HSTA is hosting another Facebook Live next week, Monday at 4 p.m. on April 28th with an EUTF representative who can answer EUTF specific questions more so than I can. All right, we'll move to the next. So part of this information campaign, well, let's just call it, I wanted to dispel some of what the heck is a HSTA VB plan. I see those listed. Does that mean all HSTA members are on those plans? So teachers are lower utilizers of health services. I've told people, some of our teachers would rather die than have to write a lesson plan, right? We'd rather go to work sick sometimes, which is not a good thing, but we do it because we'd rather do that than write lesson plans. But because teachers are lower utilizers, HSTA once had its own lower cost health plans that we offered as HSTA directly to our members. Well, in 2010, the EUTF, which covered all the other public sector workers, was teetering on insolvency. And so guess what? We looked very juicy to the EUTF. And so to stabilize the EUTF, the legislature in its infinite wisdom forced HSTA to drop our plans and be absorbed into the EUTF. And HSTA sued about it. And in December of 2010, Judge Sakamoto ruled that those in HSTA VEBA plans were entitled to the same level of coverage that they had with VEBA. So please please notice it's VEBA. That's used to be called the Voluntary Employee Benefit Association. So that's where VEBA comes from. Because those disappeared, they renamed them to, as you see at the top of the screen, HSTA VB plans. Just to shorten it, but it is not the same as VEBA. So the EUTF administers separate HSTA VB plans, which were created for HSTA employees that were previously in the HSTA VEBA plans prior to January 1st, 2011. So enrollment in those VB plans is limited to only the current people in them and those who've maintained continuous enrollment under the VB health and or life insurance plans. Everyone else, all employees that were hired after January 1st, 2011 in our bargaining unit, they are moved into those EUTF plans. And if you are currently in a VB, or if you at one time were in a VB plan and you moved out and went to an EUTF only plan, you cannot go back. It's a one-way exit door. So the VB plans eventually are going to dwindle and disappear because there's not going to be anyone left who qualifies to be in those plans. Now, I must say there is something separate from the HSTA VEBA trust. You're like, I've heard of VEBA. I have VEBA. You might have what the HSTA VEBA trust offers, which is things like short-term income protection, long-term income protection, and all those types of things, which are not necessarily health plans. But they offer those, and you can just Google HSTA VEBA Trust, and you can see all the different things that they offer that as a HSTA member, you are also entitled to enroll in separately. Now, the EUTF, when open enrollment comes around, you're going to have all these options: HMSA PPO 9010, HMSA PPO 8020, HMSA PPO 7525, HMSA HMO, which again, I said is only for those currently in and no longer for those who want to enroll in it in the future, but also the Kaiser HMO Comprehensive and the Kaiser HMO Standard. And that's a lot of gobbledygook for many of our folks who, you know, are not involved in a health plan. And I just picked one. I just closed my eyes and I threw a dart and I picked the plan, right? Because for many of you, it's like, I don't even know what the heck these are and I don't have time. And so that's what I'm hoping to help you along with. So a PPO is a preferred provider organization. It is a network of preferred providers. There's flexibility to visit providers either inside or outside of the plan's network. You don't need a referral for a specialist. You can just go directly to the specialist and say, hey, I'd like to be seen for this, that, and the other. And you don't have to select a primary care physician or PCP. On the other side is what's called an HMO, or a health maintenance organization. It is a network of professionals and facilities. So many of you are on Kaiser plans. Those are HMO plans, but as I said, HMSA also had an HMO plan. There is coverage outside of the network. I should say there is not coverage outside of the network unless it's very like it's an emergency or you get some type of referral from inside the network outside the network. But otherwise, you stay within that bubble. And you must select a primary care physician under an HMO, and the payments are simpler under the HMO. Now, part of payments, so you pay the premium that's coming out of your paycheck, you're paying the deductible, and the deductible is the fixed dollar amount that you have to pay each calendar year for certain services and products before your health plan pays. It's kind of like your auto insurance. If you get into a crash, you got to pay 500 or 1,000 or whatever you pick as your deductible, and then the insurance covers the rest. Same thing here. You go to the doctor, you get services, you pay the deductible, and then once you hit the deductible, once you pay that, anything above and beyond is covered by the plan. Then there is what's very important and that most people don't realize is what's called the maximum out of pocket, and it is called the MOOP. We refer to it as the MOOP. And that's basically, you know, if something catastrophic happens or you just have a lot of visits or things like that, it is what on the plan, what you will pay up to before the plan just covers everything else after that. So it is, like I said, the most that could be paid for covered services in a calendar year, and very important, a calendar year, so January to December, even though our EUTF plans go from July through June. Okay. Other family members on plans have to meet their own out-of-pocket limits until the overall family out-of-pocket limit has been met. So I'll talk a little bit more about that in the next few slides. And the premiums that get taken out of your paycheck do not count towards the maximum out-of-pocket. So you're going to pay whatever is coming out of your paycheck. Plus, if you have something catastrophic or you go a lot of times, the maximum out-of-pocket is whatever you pay for your services outside of that. So we'll move on to the next screen. So we are not offering you any advice as to like, you should pick this plan or that plan. We're not going to talk to you about comparing Kaiser versus HMSA, Kaiser Standard versus Kaiser Comprehensive, anything like that, because they have different offerings. And that's something that you can ask next week when the EUTF representative comes in and gives a talk about kind of those things. But what I do want to talk to you about are the HMSA PPO plans specifically, because we have the HMSA 9010 PPO, the HMSA 8020 PPO, and the HMSA 7525 PPO. Which one should I pick and what's the difference? Very critically, they cover the exact same thing. They are the same plans. It's just a matter of how you pay for the services. So that's crucial. And some people feel, oh, you know, I've heard I'm going to have a baby, so I'm going to take the 9010 plan because it's going to cover me really well over, you know, when I have my child, so forth. Or many of our members and many members, public sector workers in Hawaii are saying, I'm just going to take the 7525 plan because it's the cheapest, the least that comes out of my paycheck. So I'm going to talk to you about some of those cost structures and how they are affected. And again, we're not recommending one or the other. I just want to go through like what you're getting if you pick one or the other. I will also mention that the VB plans, the HSTA VB plans, have HMSA PPO plans, but they have some variation to the EUTF ones, but they do not have a 7525 option. All right, so here's a lot of stuff on the screen. I'll try to go over it as clearly as I can. The HMSA 9010 PPO plan, that plan pays for 90% of most healthcare costs after your deductible is met. And then you pay the remaining 10%. So if you go to the doctor and get something done, well, what's the deductible? The next row says the in-network deductible is 0. So if you stay within network in the HMSA network, you will pay nothing for your deductible under the 9010 plan. And so you'll just be charged 10% of whatever services you get. Similar with the 80/20 plan, the deductible in network is 0. And so you'll pay 20%, of whatever services. The 75/25 plan, however, you can see there is a deductible of $300 per person and $900 max for family, meaning you go for services, you pay the $300. If it's a $500 bill, you'll pay $300, plus you'll pay 25% of the remaining $200 that's left of the $500. So you're paying the deductible. So that's why the plan is cheaper, because you will pay up to the $300 if it costs $300 or more, and then 25% thereafter. So what are the MOOPs? What are the maximum out-of-pockets for these plans? The 90/10 plan has, and I'm going to just talk about the self plan, but you can also look at the family to see the similar numbers. The self plan for the 90/10 has a MOOP, a medical MOOP of $2,000, meaning as you pay that 10%, once you get to $2,000, you're not going to pay anything more after that. It's covered after that. You've hit the maximum out of pocket. And then if you have prescriptions and drugs that you need to purchase, the MOOP for that is $4,350. And then the very bottom says specialty drug individual maximum is $2,500. So if you have cancer treatment or some specialty drug, right? Not a generic. If you have some specialty drug, you'll pay up to $2,500 a year for that, and then the rest will be covered. So that's what a MOOP is. Now you'll notice the 90/10 has a self MOOP of $2,000 for the medical. The 80/20 has a MOOP of $2,500, so it has a slightly higher maximum out of pocket because you're going to be paying less per paycheck for the 80/20 plan. Then you look at the 75/25 plan. The MOOP for the medical part is double the 80/20, right? It has a $5,000 maximum out of pocket. So you're again paying those $300 if you go see the doctor every time and it's $300 or more, and then you're going to pay whatever the more is at the 25% rate. But once you hit $5,000, if you pay $5,000 out of your pocket for that calendar year, you will not have to pay anything more for medical services because you've hit your maximum out of pocket. So knowing what you pay, now it's at the top. So knowing what you pay for the maximum out of pocket, well, what are you paying in your premiums? What's coming out of your paycheck versus coming out of your pocket, which I know is the same thing, but stay with me here. The 90/10 plan, if you take that, the monthly amount and you multiply it by 12, that's the annual amount. The 90/10 plan costs $6,423.36 for your self plan. Similarly, the 80/20, it doesn't cost quite as much. It's $4,275.12 for the whole year if you're paying for the 80/20 plan. But if you look at the 75/25 plan, you pay a grand total of $703.44 out of your paycheck to have the $75/25 HMSA PPO plan. So that's how much you pay out of your paycheck. And then you look at, okay, well, what if I have something catastrophic and I need all kinds of drugs and I need to pay the most amount that's going to be my MOOP. So on the next slide, kind of taking a look. Well, what are all the MOOPs plus the annual premium add up to? If something catastrophic happens to you, on the 90/10 plan yourself, it's going to be, you're basically saying the $2,000 for the medical, the $4,350 for the drug, and you may not even need, who knows, you may not need all the drug amount or all the medical amount, and you're paying your premium of $6,423.36. You're paying in total, if something catastrophic happens to you, $12,773.36. I must say again, this is only for in-network. If you go out of network, you might be charged additional fees, and there's a whole bunch. That's why I have on the bottom simplified scenarios, other situations, and costs may apply. So the 90/10, something bad, really, really bad happens, you're going to pay $12,773. On the 80/20 plan, something bad happens, you take all your maximum, you maximize what you're paying, and also your premiums. The total comes out to $11,125.12. And then on the 75/25 plan, something bad, the exact same bad thing happens to you, and you pay all your maximum out of pocket, and you pay your monthly your per paycheck premiums, the total you're going to pay is $8,853.44. And please, I need to express to you again, these three plans cover the same thing. It's just how you pay for them. And if something catastrophic happens to you, you can see the difference in price that you're paying for the exact same product. So I'm hoping that that helps you to make some decisions as to what you want to do. I'm not talking about the Kaiser plans because, again, they have some variations. They're not exactly the same like the HMSA, the three HMSA PPO plans, but hopefully that's been helpful for some of you to dispel like what the heck do all of these things mean. Please watch again if you need to refresher. And we will be taking some questions as soon as I'm done with this slide. But I just wanted you to remember that open enrollment will take place from May 1st through May 30th of this year. It's usually been in April, but we pushed it off to May. And those new plans and the amounts that they take out of your paycheck take effect July 1st. So on your July 5th paycheck, I believe, is when you'll start seeing the new amounts happen. During open enrollment, we have people who are like, oh, I'm going to pick this. You know what, never mind. I heard about this and I'm going to pick that. If you keep submitting forms or if you keep going online and making different changes during open enrollment, whatever the last one you submitted is the one that's going to count, right? So if you submit 3 times, we're not gonna look at the first 2. We're just going to take the last one. I encourage you to go to eutf.hawaii.gov for all the information you need about plans and so forth. And as I said, there are hard copy forms, but also there is now the member portal. And I suggest to you, all of you, to go to the member portal if you have a health or a life insurance plan under the EUTF. That's at eutfbenefits.hawaii.gov. Again, eutfbenefits.hawaii.gov. That is your member portal where you can log on, see what you currently have. When open enrollment happens, there's going to be a tile that opens there. You can click on there and make your selections for changes. If you have a child, or if you get married, or if you get divorced, sorry about that, and you need to make changes, the portal is where you can do all those changes without having to do paperwork. So I highly suggest, even if you're not going to change anything about your plans, log on to eutfbenefits.hawaii.gov, create your account if you haven't already, and use that in order to be able to make changes at any given time or to look at what your plans are. I hope this has been helpful. That is our goal, to make these things as easy as possible, despite being as difficult as they can be sometimes. I'm very grateful to Andrea Eshelman, our Deputy Executive Director and Chief Negotiator, who helps us to figure all these things out and make them happen. And yeah, we're looking if there's any questions, and so far we don't really see any questions in the chat. So I'll see if Andy has any last words as we kind of.
Yeah, so far no questions. I'll note that this will be archived on Facebook for a short period. Facebook has actually changed some of their policies, so the videos don't stay up as long as they used to. We're also going to make sure it's on our YouTube channel, and we will have a short story with a link to the videos in this week's email, our Member Matters. If you're not on our Member Matters email list, please go to our website and get yourself signed up for that. And I'm looking, it looks like we don't have any additional questions. And actually, you addressed the one question that I thought of, Osa, while we were talking, was to talk about the online portal. I know we've heard a lot of really positive feedback about that. It helps to prevent errors and things like that when people are doing it on the portal versus filling out the paperwork. And in the past, we've had issues where paperwork got delayed. So I'm super excited that we have that as a new option for employees. Anything else also that you can think of that we should be covering?
No, I encourage you folks to also watch next week Monday's Facebook Live, either live or after the fact, to see where he will go through some of the different plans and what the costs will be and so forth and so on, and make those decisions. You could be saving a lot of money depending on the plans that you select. So it is important that you be careful about the plans that you select. We at the EUTF board often get people who have to ask us, I made a mistake, can we fix it? And I will say, as an employee trustee, we're always looking to make allowances for our members if mistakes happen, but I will say that the employer trustees don't always have the same sentiment in mind, and oftentimes they will say, no, too bad, they missed this deadline, they pressed this wrong button, they indicated this wrong thing. So it is important that you please be careful when you make your selections. And I will also say that please be patient on the member portal. I was on it last night just checking things, and it's not the snappiest of websites, I'll just say. So with that, I want to thank everybody for joining us today and thank everyone who's helped us to get to this point. Mahalo for being a member. Mahalo for all that you do. And with that, we wish you a good evening. Aloha.
Aloha, everyone.